Thank you, Mr. Chairman. Good afternoon, everyone. It's my pleasure to be here. I invite, thank you and for invitation from Dr. Banchi and the organizing committee. Actually, it's difficult to answer this question in just 10 minutes, but I will try to do it. First of all, this is a greeting from Egypt to you all in India. This is Egypt by artificial intelligence, and I'm coming from Mansoura. Mansoura is a 70 kilometer to the north of Cairo. This is my hostel in which I work in, and this is my faculty of medicine. When I was in the primary school, I carry a lot of things to do my routine daily activities. All of us, I think, in the same age, and maybe some of you are elder than me, but we are carrying all these objects, and this is just making our need in their daily activity. But nowadays, it is just in my mobile. I do all of this and better than this with a simple thing, which is my mobile. This is my first mobile I have hold in my life. It was Alcatel, I remember it well. I never care about it. I can throw it in the air. I never care about the battery. It's take 2 or 3 days to recharge again. Only notification from it is just there is an incoming call, and this is only. But nowadays, with my new phone, there is a lot of challenges of it. Although it is easy my life more and more, I can do a lot of things from my mobile, but there is a lot of drawbacks. I need to recharge it every 12 hour or every 18 hour. A lot of notification. Till now, I always doing my mobile silent because once my mobile is ring, usually there is a conditioned reflex and there is some palpitation because no one call me to say hi. Always want something from me. Also, I'm afraid about the privacy and the security. It's the same here. Always, they need something from me. Even my wife and my children always needing something. No one wants to give me anything. Okay. The development in diabetes technology is very good and it solves a lot of problems. However, on the other side, there is a lot of challenges from using or dealing with diabetes technology. The previous lectures have discussed the development of insulin and changes in the pharmacokinetics and pharmacodynamics, and the development of insulin pens, the development of insulin pump, from the portable insulin pump to the patch insulin pump nowadays, which is available, the journey of monitoring of blood glucose from the Benedict in the urine till the glucose oxidase in the strips now, the CGM and the future of a non-invasive, there is a great lecture about it. All of this are great development in the technology and even part the diabetes technology. There is a good of things. There is a lot of research. I have no time, unfortunately, for this, but if you Google it, you will find a lot of research about the benefits of diabetes technology. But let's highlight the most important things, that how using of diabetes technology is important for diabetes health. Number one, it is every one of us use diabetes technology. It is very, very, very clear that persons who are using diabetes technology and the CGM and the new pump and the new meters have a less complications, either acute or chronic complications. The long-term outcomes of the patients are improved with using technology. Also, the quality of life with patients with type 1 diabetes and even type 2 diabetes is improved while we are using technology. Screening and assessment and diagnosis of the psychosocial barriers of diabetes becomes easy now and easy to be treated. Not only the organic complications, but also the psychosocial barriers could be improved. Also, with using telemedicine and diabetes technology, we can give the patient-centered medical care. The best of care could be given a patients even with a not direct contact with a doctor in peripheral countries or peripheral cities or poor countries or a low socioeconomic standards. We can, with diabetes technology, we can give the patient the best of standards of care. And here is an example for this. Also, presence of diabetes technology, contact with the doctor and with the patient and with the health educator and with the dietitian and with the registration and with the government, all of this help in patient engagement and life coaching and decrease the stress related from diabetes. I remember in the beginning when I was a young resident, those patients with type 1 diabetes usually feel shameful, and a lot of parents don't tell the teacher and don't tell the surrounding that their kids having type 1 diabetes. Now, with improvement and with diabetes technology and with CGM and with increased the social awareness, there is a lot of acceptance of presence of diabetes. Also, presence of new CGM and new mobile applications and new alarms, and there is a hypo coming, there is a hyper coming, we need to do correction doses. All of this are good things that help the patient to become adherent to the treatment and minimize hospitalization, especially for the hypoglycemia and for the DKA. Also, the COVID was just a few years ago. If there is no telemedicine and if there is no technology and there is no digital health, the healthcare system will be lost. The presence of the technology lead to stability of the healthcare systems, especially during pandemics and during wars. I like while I'm preparing my lecture, I like this term from my professors and my teachers here in India, Dr. Jyotidev and his colleagues, about the tele-diabetology. I like this term, and usually this is a very, very great term, that there is a special part of the telemedicine, which is the tele-diabetology. All of this are the benefits on the outcomes. But on the other hand, the rapid advancement of diabetes technology have some challenges and some limitations and concerns. Number one, in Egypt, and I think the same here is in India and a lot of countries, is the insurance policy and the provider's practice. A lot of patients which is in need for insulin pumps and CGM do not find who support them, and this is usually expensive for them. Also, not all the patients have the same socioeconomic standard and have the same technology curve. There is some patients which resist and they have a slower technology learning curve. Also, when there is a lot of notification in WhatsApp, when there is a lot of notification in your laptop, when there is a lot of notification in sensors, this is have information and have a data, and this is make burden on some patients. Also, patients' adherence and acceptability to have a wearing CGM and to be on social media with your friends and to accept that you are having diabetes or wearing insulin pump, all of this, not all patients is accepting this, and this is an important limitation and challenges. Also, the reliability. The lecture about the CGM and the innovation and the promising non-invasive CGM, not all of them till now is reliable. So this is one also of the limitations. And finally, the privacy and security. All of this are challenges when you are dealing. Now, everything, your data is on the cloud. A lot of doctors and a lot of healthcare providers seeing my data. I'm aware that someone may hack my pump or take my data for any other things. All of this are having some challenges. There is a lot of factors that exacerbate the treatment burden with the new technologies. Number one, there is a lot of patient factors here, as you see. Number two, there is a lot of situational factors like in travel, like in marriage, like in changing weather and changing atmosphere. And finally, there is a structural factors like the do-it-yourself pump, and there is a synchronization issue with some pump and some CGM, with the laptops, with the softwares. All of this are burden and factors increasing the burdens from diabetes technology. So how to solve it? Finally, in the last minute, how to solve it? Do you remember my mobile? Yes, it helped me a lot. I have a lot of benefits. I can do a lot of things, whatever the place I am in. But this is the drawback. I can deal and take the benefits from my mobile, and I can deal with the drawback of my mobile. For example, the mobile have a great things. Just I enter my home, I make the don't disturb mode. All the notifications are lost. So this is once I have a problem, once I have I don't want any notification, you can stop the notification. Also, when I'm having a lot of work, I can carry a power bank. This will help me for the battery. I can have a great screen protector and cover for the mobile to protect it and make it more durable. And sometimes I close my mobile, I leave it in the home, and I go to relax to avoid the burden and the psychological stress from it. What's my take-home message, Mr. Chairperson, Mr. Chairman, and dear colleagues? What my chairperson? There is a lot of benefits from using technology, a lot of data, a lot of improvement what's happened, a lot of improvement in the outcomes, but on the other hand, there is some problems in the cost. Here is how to limit, finally, here is how to limit the burden from the diabetes technology. Number one, focus on the usability and the patient-centered approach. Number 2, address the cost and access to the insurance coverage and financial assessment. Number 1, you can manage with each patient the data overload, and you can deal with it and address the psychological impact and continuous innovation and research development. Regarding low sources settings and countries, how to deal with it, we can use the telemedicine and consult doctors in a well-established area. We can use it to give treatment and to give decisions, and we can educate doctors and physicians and diabetes educators. I finished my lecture. This is a greeting again from Egypt, and happy to be here with my Indian friends. I invite you. This is the first Pan-Arab Society, International Congress of Pan-Arab Society of Diabetes Technology and Interventional Endocrinology. We have a lot of doctors there from India, and I invite you to attend the second version of it. It will be from the 13th of April to the 2nd of May in Alexandria, Egypt, and thank you.